that then an individual, regardless of where they're working, can maintain their health insurance coverage when they move from job to job, and whatever employer they're working with at the time, if they have decided to make contributions, can pay those contributions in there. Or the individual could hopefully go there and get income-related support in order to be able to afford coverage there. So I think most of us are realizing that, particularly for small businesses and some medium-sized businesses as well, it is inefficient for them to be the location of purchasing coverage. But these purchasing entities are basically the solution to the issues that I think you're raising.
I might add that in addition to the issue of so-called job lock of people making decisions as to who they work for and so on, there's, of course, the other issue, which I'm sure you're very familiar with, which is how people's decision to go into business for themselves is affected by the insurance issue itself. There's not been so much research done on that, but we certainly know anecdotally very much how that is affected. We've done some early sort of summary of the research that's out there. I'd be more than happy to make available to the committee.
I think that Dr. Butler is making an extraordinary point, that one that should be unpacked further by this committee, because this drain on entrepreneurial productivity is very real because of this issue.
We'd certainly like to be helpful in that. I mean, we see it all the time of people who just cannot go into business for themselves unless they have coverage through somebody, through a spouse, for example. And you see these patterns very, very clearly. And people who maybe get divorced and then lose that, and then suddenly they're in business and they really cannot afford to continue because of the immediate effects of running out of COBRA and so on.
If I could, yes. Stuart mentioned, and I welcome to see it, it's been hard developing sort of empirical models to do this, but I think he probably knows, I certainly know, there's surveys of people thinking of business formation, and I know Todd Sotomayor, the president of NFIB, has made it very clear, and I think he's got hard survey to back this up. It's the number one problem, it's the number one impediment to business formation, is worry about how you're going to cover your family and your would-be employees. So I couldn't agree more, it's very important.
Okay, we are having some votes on the floor, but I have two more questions, and then Mr. Shabbat, if you have any other questions. Dr. Nichols, despite some of the successes of the Massachusetts Commonwealth Connector Plan, it hasn't delivered on the promise of low-cost small business plans. Small businesses appear to be disproportionately funding the state's healthcare system in comparison to big business and government payers. Do you believe that there was a way that this could have been avoided?
Well, Madam Chairwoman, I think the fundamental cost structure in Massachusetts is driven by the unfortunate fact that health care costs a lot in Massachusetts, and unfortunately there's no magic wand you can wave when the providers up there get paid what they get paid, and that's the fundamental thing. Now, Linda actually probably knows more about Massachusetts specifically than I do, so I will defer to her. But I will say, when you structure a new marketplace, I think all of us would agree, you have to have transitions that are smooth. You don't want to have a big jump. Massachusetts had a fair number of benefit mandates that were already in place, that in some sense the market had adjusted to. You could get money back, although not nearly as much as the advocates would tell you. You can get money back by taking mandates away, but if you do that precipitously, you end up uncovering cancer and so forth. So you have to be careful about that. What they did do, which I was very much in favor of, was they allowed there to be products sold to young workers, to young people, between, I think, 21 and 29, that had fewer mandates so that they could offer those people a little bit lower premium. But, Linda, you may want to speak to the...
No, I think the underlying cost structure of the state is the major issue, and they are focusing their attention now on strategies to contain costs. It was a very difficult political calculus to try to expand coverage substantially while at the same time containing costs, lowering provider payment rates, et cetera. It would have been a very difficult piece of legislation to pass without support of the provider. So now I think the focus is on cost containment. But I would mention that in the survey that was done by the Urban Institute since the reform implementation and more recent, then the survey was done again more recently, it was demonstrated that employer-sponsored insurance coverage in Massachusetts has increased since the implementation of the reform. So more employers seem to be offering and more workers taking up.
Okay. Dr. Butler, you suggest giving tax credits to individuals as opposed to employers because it is more effective means of expanding traditional coverage. Can you envision any circumstances in which tax credits for small businesses could be effectively used to expand coverage?
Well, I do think that there's a case to be made for, in the transition especially, and if you're asking employers to set up systems, and we see this area, incidentally in the area of pensions as well, that legislation has been put forward to say there's a direct cost to a small business person that might discourage them from setting up an alternative system. I think covering that can make sense, to cover those transition costs. What I was referring to is the idea of trying to subsidize, to provide a tax subsidy directly to the employer in order to bring down the cost of coverage per se. So I would draw that distinction between the role of any kind of subsidy to the small employer.
Yes, I am sure Mr. Haynes want to comment.
Yeah, I would
And go to
say,
Mr.
I think looking specifically at the Choice Act is probably dramatic evidence to the contrary, because I think in our situation, the tax subsidies would allow us to bring a lot more people into our existing pool. Frankly, I think more money would be saved by the people who wouldn't get by the employers who wouldn't get the subsidies than the people who would get the subsidies. And there'd be more benefit to the participants in the pool that we could create outside of the group being subsidized than inside the group.
Well, with respect, I mean, the actual econometric data that's been done, there have been a number of econometric studies looking at this in terms of, if you like, the cost, the loss associated with providing a subsidy to an employer who is already providing coverage to their employee, and to try to level the playing field. There's a huge loss associated with that. And I mean, econometricians do look at these things. And the data, I think, is pretty clear that it really is almost pushing on a string in terms of cost. It costs an enormous amount for those who are already covered if you go through the employer. And it's a much higher method of trying to cover those people. I just think the data shows that very clearly.
I